Hi, my name is James Galang. I'm a student nurse, and for today we're going to talk about electrocardiogram. What is electrocardiogram? Electrocardiogram, or also known as ECG or EKG, records electrical signal in your heart. It's a common and painless test used to quickly detect your heart problems and monitor your heart's health. Before performing the ECG test to the client, you have to assess for the following. Number 1, assess clients for the level of consciousness and level of knowledge and understanding. Second, review the patient's medical records, plan of care for information about the client's need for ECG. Third, assess the patient's cardiac status, including the heart rate, blood pressure, and auscultation of heart sounds. To start for the procedure of ECG test, you have to check and verify the doctor's order first. Second, identify the patient using two identifiers, which are asking the full name and stating their birthday, and explain the procedure to them. Third, perform hand hygiene and put PPE if it's indicated. Fourth, close the curtains around the bed and close the door if it's possible. Fifth, have the patient lie supine in the center of the bed with armrests on the sides and raise the head of the bed if it's necessary to promote comfort. Expose the patient's arms and legs and drape appropriately. Encourage the patient to relax the arms and the legs. Select flat, fleshy areas on which to place the electrodes. Avoid muscular and bony areas. If the patient has an amputated limb, choose a site on the stump. If an area is excessively hairy, clip the hair. Do not shave the hair. Clean excess oil or other substances from the skin with soap and water and dry it completely. Apply the limbed lead electrodes. The tip of each lead wire is lettered and color-coded for easy identification. The white or RA lead goes to the right arm and the green or RA lead to the right leg. The red or LL lead to the left leg. Connect the limbed lead wires to the electrodes. Make sure the metal parts of the electrodes are clean and bright. Expose the patient's chest. Apply the precordial lead electrodes. The tip of each lead wire is lettered and color-coded for easy identification. The brown or V1 to V6 leads are applied to the chest. Peel the contact paper of the self-sticking disposable electrode and apply directly to the prepared site as recommended by the manufacturer. Position chest electrodes as follows. 12 lead precordial lead placement. V1, 4th intercostal space, right margin of the sternum. V2, 4th intercostal space along the left margin of the sternum. V4, 5th intercostal midclavicular line. V3, midway between V2 and V4. V5, 5th ICS, anterior axillary line, same level as V4. V6, 5th ICS, mid-axillary line, same level as V4. After the application of all the leads, make sure the paper speed selector is set to the standard of 25 mm per second and that the machine is set to full voltage. Ask the patient to relax and breathe normally. Instruct the patient to lie still and not to talk while you record the ECG. Press the auto or print button. When the machine finishes recording the 12 lead ECG, remove the electrodes and clean the patient's skin, if necessary, with adhesive remover for a sticky residue. After disconnecting the lead wires from the electrodes, dispose the electrodes. Clean the ECG machine per facility policy. Remove additional PPE if used. Perform hand hygiene. And document the procedure and other observations. That's all for today. Thank you for watching. Bye-bye!